Hello, this is the training for diet adherence specifically for participants in Module 3 of the Nutrition for Precision Health study. In Module 3, participants will eat all of their meals under supervision of the study staff, so they will not be asked to self-report diet adherence daily as they are asked to do in Module 2. All provided study foods and beverages should be completely consumed during the meal or snack time that the items are provided. Study staff should be present during meal times to ensure that participants completely consume the meals and to address any adherence issues as they come up. Any foods or beverages left uneaten will be weighed back and documented by kitchen staff. A study dietitian or member of the study team will meet with all Module 3 participants briefly on the second day of each diet period to discuss expectations related to adherence. This discussion can include topics such as reminding the participant about the expectation to completely consume the foods and beverages provided, designated meal times, and optional foods, which we will discuss later in this training. Specific time windows are designated when participants may eat their meals during Module 3. Breakfast may be eaten anytime between 7 o'clock a.m. and 8:30 a.m., and participants are weighed each morning before eating breakfast. Lunch may be eaten anytime between 11:30 a.m. and 1 o'clock p.m., and dinner anytime between 5:30 and 7 o'clock p.m. The timing of snacks can be flexible depending on the individual site or participant preference. Once the participant begins the meal, they should be encouraged to finish it within 30 minutes. Start and stop times should be recorded for each meal. Participants may eat alone, for example, in their individual room, or in a group setting, for example, at a common dining table. Either way, a staff member must be present to monitor each meal. The purpose of this is to ensure that all items provided as part of the meal are consumed and to address any issues that may come up during the meal. Participants are encouraged to have visitors, although visitors may not bring outside foods or beverages except water, and visitors are not allowed during meal times. Care should be taken to limit access to garbage cans and restrooms during meal times, and it may be a good idea to check napkins and stacked plates, especially if there are concerns or suspicions of diet non-adherence. So what does it mean to ask the participant to completely consume the meal? Well, skins of fruits and vegetables should be eaten when edible. For example, if apple slices are served with the skin on, then the skin should be eaten. Milk should not be left in the bottom of a cereal bowl, and juice should not be left in the bottom of a bowl of fruit. Foods like gravies, sauces, mayonnaise, salad dressings, and yogurts should all be sopped up or scraped clean from the containers with a utensil. Small spatulas can be provided to participants as necessary to help with this. With the exception of water, participants are not allowed to have any extra seasonings or beverages other than what is provided on their tray. So items like salt shakers and sugar caddies should be removed from dining tables. Participants are provided with some optional food items. These items may be provided to the participant to use at their convenience. However, the use of these items is limited and must be documented. Up to 2 salt packets and 2 pepper packets are allowed per day. Participants may also have up to 2 cups of study-specific coffee or tea with their meal of choice. But please note that caffeine should be eliminated after 12 noon the day before the RMR test. With coffee and tea, participants may also have up to 2 creamers, up to 2 sugar packets on the purple and blue diets, and up to 2 swerve packets on the orange diet. Again, the use of these optional items must be documented by study staff. Participants may have an unlimited amount of water, but water intake must be documented. Provide water to participants in bottles at a known volume, such as a graduated water bottle filled to the top graduated mark, and document how many bottles are consumed. So, what should you do if the participant leaves uneaten food on their tray? First, gently encourage them to finish the meal. One strategy is to let the participant take a short break from eating before trying to finish the meal. You can also ask them if using an optional salt or pepper packet will help. If the participant doesn't like a specific food item, you can start a countdown for the number of times left that they'll be asked to eat the food. You only have to eat this broccoli 5 more times, and then only 4 more times. You can do it. Please note that the participant should not save any food from one meal to finish at the next meal. If the participant is still not able to finish the meal, please notify the study dietitian or kitchen staff. The kitchen will weigh back the uneaten food according to procedure and document the weight of the uneaten food in the diet analysis for that participant for that day. The study dietitian will meet with the participant to discuss the reasons for non-adherence and to collect any additional information. Most importantly, please do not throw away any uneaten study foods or beverages, including salt, pepper, creamer, coffee, and tea, before speaking to the study dietitian or kitchen staff. If the participant complains of being too hungry and they are also experiencing weight loss, notify the study dietitian immediately as additional calories may be needed. If the participant's weight is stable, then there are a few strategies that can be used to help manage hunger. Offer to adjust the timing of the participant's optional coffee or tea, or to provide additional water. Offer to adjust the timing of the meal within the meal window. For example, if the participant is complaining of being hungry mid-afternoon, then perhaps moving the lunch meal later within the designated meal window and the dinner meal earlier within the window will help. The timing of snacks can also be adjusted to help curb hunger at specific times. We would like for the participant's weight to remain stable during Module 3, so the study dietitian will monitor weights daily for major or sustained changes, so that calories can be adjusted according to the study protocol when necessary. If you notice that a participant has experienced a major or sustained weight change, especially if they are experiencing excessive hunger or fullness, please do not hesitate to notify the dietitian. Please note that small or short-term weight fluctuations are considered normal and would not necessarily indicate a calorie change. After meeting with the participant to address adherence concerns, reviewing daily weights, and consulting with the study team, a decision will be made about whether to adjust participants' daily calories. Let's review the main takeaway points from this training. Participants are expected to completely consume all foods and beverages provided during Module 3. Additional non-study food items, beverages, and seasonings are not allowed. Coffee, tea, salt, pepper, sugar or sweetener, and creamer are all study-specific products provided in controlled amounts. Water consumption should be documented. If a participant is struggling with adherence, please notify the study RD as soon as possible. And please do not throw away any uneaten study foods before speaking with the kitchen staff or the study dietitian. When challenges arise, motivational interviewing and behavioral counseling strategies can be used in order to build rapport with the participant and to work together to find a solution to adherence issues. The participant has the most important role in the study, and by adhering to the diet, they can help ensure the study is a success. Thank you, and good luck.